Welcome to the Autism Recovery Summit 2, Hope and Possibilities. I'm your host, Luminara Serdar. I'm a holistic practitioner using neuromodulation technique, nutrition, and detoxification to help kids recover from autism. And we're speaking with Dr. Ernesto Gutierrez today, and he's a physician trained from Anahuac of Medicine, which is a very prestigious, the most prestigious private medical school in Latin America. And he's had trainings in the US and abroad and additional degrees in age management and regenerative medicine. And he is the president of World Stem Cells Clinic in Cancun. So welcome, Dr. Gutierrez.
Well, thank you very much for having me. It's great to be here again.
Yeah, you were here last year, and we hopefully all our listeners learned tons of great things about stem cells from you. And we're going to learn some more, and it's a year later, and we want to hear some more, what's happened in the last year. So I think I want to start with, I love that you wrote to me this sentence. I'm going to read it, and then we can speak to that. That you believe in today's age, the only way for patients to adhere to a treatment plan is if they fully understand what's happening with their bodies and work together with their physicians to treat it. So you really believe in patient education and really them like full disclosure in a way, right? And them really know what's going on.
Absolutely. Not only full disclosure, because it's not all about bad things or side effects or things like that, but it's more like recruiting the patient so that they can be part of their own recovery journey. And it doesn't really matter if we're talking about autism or we're talking about any of the other conditions that we treat at our clinics. I think it's terribly important to educate the patient in exactly what's going on so that they can understand why certain things happen, why the proposed treatments are being proposed, and what they can expect from it. I think it's very old-fashioned to think how we used to think that the doctors were really the rulers and like, well, you're going to take this and you're going to call me in the morning and you're going to feel well. And patients really didn't understand what was going on. Today, we really have to educate them because otherwise they will find or they will try to educate themselves, and that might be counterproductive because when you go online and you start looking for all these different answers, you really don't know who's going to be giving the advice and where they're going to be learning from. So what we try to do, and we've always really tried to do it this way, is to bring them in. So when we talk about kids with autism, we try to explain to parents, okay, this is what's going on. This is how much we understand about autism. This is what our therapy does. And these are the improvements and the results and the changes that we're expecting, so that they can also complement. We've learned a ton from parents who feel involved, who feel part of the treatment. And they're the ones who get back to us and say, you know what, now my kid's sleeping much better. And that's how we learned that, we're also affecting the cycle of the melatonin cycle. And somebody else came over and said, now my kid is verbal. And so we started going in that direction. And it's really the only way to get important, long-lasting improvements, I think.
Yeah, I really appreciate that you guys are doing that. So thank you for being out there doing it and maybe setting a trend. I find that many of the practitioners in autism recovery or helping kids with autism are way more into really educating. And I feel like as people, we need to be educated in that. So thank you for doing that. So I would love you to tell us a little bit, is there anything else you want to say about your background and how you got into this?
Well, it was actually a funny story. When I finished medical school, I always wanted to be a pediatrician. So I did get started on my residency, and a couple of weeks into it, I realized that the kids were okay. It was just the parents that I couldn't handle. So I dropped out of it, and not having much to do, I started shadowing a physician, and then I ended up doing some studies in regenerative and anti-aging medicine. And from that, I started getting more involved with the regenerative side of it. And then I was invited to participate here at World Stem Cells Clinic with the stem cell research that we were doing. And funnily enough, I ended up treating kids. after all these years, and it's something that is very, very rewarding. It's something that is that we're really proud of being able to do this. But not just us; we're not the only pioneers. Also, the patients who are participating with us in these first couple of years, they're also pioneering this field. So it's terribly exciting, and we're very excited, very motivated to keep going in this direction. So
Excellent.
yeah, that's pretty much the shortened version.
Yeah, well, thank you. So, for people who are watching who might not know what stem cells are or stem cell therapy, could you give us a little background on what is a stem cell? Do we have them? What do you do with them?
Yeah, sure. So the thing is, we all have stem cells. It's the way our body repairs itself and regenerates itself. We've all heard that we renew our cells every so often, our skin, our bones, everything. So that's how we grow. We have these little cells, and they start differentiating, which means that they start becoming a specific tissue. So from this one cell, then they will go into and branch to become, I don't know, let's say a muscle cell, and from that one can become a cardiac muscle or a skeletal muscle or different kinds of muscles. And the same thing happens with every other tissue. They start becoming more specialized. The way I normally explain this, both to my students and to patients, is think of it as when we're growing up and we go to school. And we all go to same kindergarten, we all go to same elementary school. And then once we get to high school, we might start going into different fields and different concentrations depending on what we want to do. So some of us might go into the biology field, some others might go into social studies, some others might go into the math and physics and those kind of things. And eventually you'll get more specialized, but you all started from the same spot. And it's the same thing with our cells. They all start in the one spot, and then they start becoming more and more specialized until we get the different tissues. What we're currently doing here at the clinic is we're harvesting the patient's own stem cells, the stem cells that we still have in our body, the way that our body repairs when you fall down and you scrape a knee. What happens? Well, stem cells get there and become skin cells, and they sort of repair that area. So what we're doing is we're grabbing these immature stem cells, and well, not really immature. I don't want to say technically they're not immature. They're mature cells, but they can still differentiate. So we grab these cells and we concentrate them outside of the body, and then we put them specifically where we need them. So whether it is in the central nervous system, whether it is around the gut, whether it's IV in the lungs and the bones and joints and muscles. So basically that's stem cell therapy in a very resumed manner, in a very shortened manner for everyone to sort of understand.
Great, thank you. I hope everyone has the feel for what the stem cell is and how you use it. And I have a curiosity that is, when we spoke a year ago, you spoke at our summit, and I've heard you speak at other venues. I believe you were injecting them specifically in the spine, and so they would get into the brain. And now it sounds like you've branched out a little bit. Can you speak a little bit about in the gut or in the bone or wherever you're putting them?
Yeah. Well, we've always done a different approach. It's not just a single infusion. So we've always done a multi-site approach. We started learning, as many other physicians and health professionals who start treating autism, we came into the field thinking that it was a purely neurological condition. As we started learning more about it, because I always tell this to patients, we're not autism experts, or we weren't autism experts. We started as stem cell researchers, so cell biologists, physicians, and then we started learning more about autism to be able to grab our therapies and apply them there. So first we thought it was purely neurological, and that's why our infusions would go into the cerebrospinal fluid, and you do this through a lumbar puncture, right? So you don't go into the spine, you go through the spine into the cerebrospinal fluid. And the cerebrospinal fluid bathes the entire central nervous system, so the brain and the brainstem and everything else. And we deposit the cells in there so that they will cycle around and they will bathe the brain and they will get to the areas where they need help. However, we also do IV infusions, and these IV infusions help because stem cells recognize inflammatory markers. Think of it, inflammation isn't a bad thing in and of its own. That's the way our body recognizes something that needs attention. And I always tell patients and my students alike, think of inflammation as when there's an accident in the road and you get out and you put your little cones around the car and you do your signalers and you do your flashers on the car. That's pretty much what our inflamed tissues do. They send out these signals so that other cells can find them and they can come and repair. So that's exactly what stem cells respond to. And when we do an IV infusion or intravenous infusion, the stem cells will start circling around the body and they will find the areas that are damaged because they're presenting inflammation. Most likely, now we know it's in the gut in the cases of autism. So they will find these sites and they will be able to go there and repair. And we've seen that the way we've understood that this is happening is because we see patients after stem cell therapy, they're able to clear their heavy metals much more effectively. And it doesn't mean that stem cells come in and throw away the heavy metals and throw away all these toxins. It just means that they're effectively closing the barrier so we're no longer absorbing them. And everything else that you're doing in your biomedical approach, whether it's chelation or whatever else it is being able to clear them away. So really, it's a multi-step approach. We address several areas, and something very important to emphasize is that you don't do stem cell therapy instead of everything else you're doing it. You do stem cell therapy in addition to. That's in fact one of our criteria. If we get somebody who just wants to do stem cell therapy because they can't be bothered to do everything else, then we simply won't accept them as a patient because we're not going to be getting any improvements. We're not going to be getting any important change. So it is important to understand we do both the intrathecal, and that one will get across the blood-brain barrier, which happens if you just do IV, and those cells will get to the brain and bathe the central nervous system. And we do IV. Most of the time we do 2 IVs in consecutive days, and those are the ones that actually go to the gut and will also sort of reboot the immune system. That's the basis of our treatment for autoimmune disorders. So rheumatoid arthritis, lupus, all these things, we treat them in a similar manner by rebalancing the immune system.
Okay, so what I'm understanding is the stem cells, you're putting them intravenously, you're putting them in the lumbar puncture, but basically they're functioning as sort of a reboot for the immune system. And they're additive to whatever other I don't want to say therapies as in like...
Yeah, every other intervention.
Intervention.
It doesn't matter what we're talking about. I mean, we've seen this, and the great thing that we've seen is that it actually boosts the results of anything else that you're doing. So you will see better gains. So parents who have been doing ABA therapy, just to name something, and they see that they really don't have an improvement, they're stuck here. After stem cell therapy, what's going to start happening is that now they see the same therapist, but they're going in this direction, so they're getting better afterwards. That's why the kids start verbalizing. So they don't recover that on their own, and the stem cells don't necessarily install language in them. But what happens is that it makes them able to start installing these new behaviors, to start responding to these new behaviors. And when we're talking something metabolically, like I said, it allows anything that you're doing in terms of detoxing, all the biomedical approaches, all these different things, it helps them stick because you've now rebooted the immune system and you've sort of closed the gap in the gut, so not that much stuff is coming in that shouldn't be coming in. Yeah. So that's the way that it really helps everything else. But if you're not doing any of these other interventions, you're going to stay at the same place. You're going to be stagnant. Sure, You're not going to get worse, but you're not going to get it better.
Right. So it sounds like this is part. I know we talk a lot about leaky gut, and kids, the gut is a big issue, and so it sounds like this helps to heal the leaky gut, so those big particles don't get through, and all the other.
Well, absolutely. That's the big goal for it. And now that earlier you mentioned and you asked about what's new and what we've been doing this year, we're doing a lot more studies and we're doing a lot more different approaches. So we're comparing now our own allogeneic cells. So we normally use autologous cells, which means that they come from the same patient before we treat them for autism. But our company also produces our own allogeneic cells from cord tissue, and we use those for other conditions. And now we're going to start doing studies to compare them in the treatment of autism. And we're going to really start, one of our goals is to really start seeing if and how much improvement we get in the gut lining. and see if we really do make that effort. These are conclusions that we've arrived at based on observations, based on lab results, and based on interactions with other practitioners. And they're the ones who say, well, this must be what's been happening. Because, I mean, like I said, we didn't even expect most of these things. Parents would get back to us and say, you know what, my practitioner wants to talk to you guys because my son's new tests came down and they're a quarter of what they were before. His heavy metals are much better, and she cannot explain why that would happen.
Wow.
And we were like, well, neither can we, so let's get on the phone and try to figure this out. And that's how we've been learning a lot about it.
That's cool. You really are a pioneer. And with the practitioners, I mean, we kind of all are, aren't we?
Absolutely. Yeah, that's one of the things that I think that's why we've had such a great welcome these last couple of years in the autism community, because I mean, stem cell therapy for autism has been around for a bit, but I think that it's really been in the last maybe 12, 18 months that it really started taking off and started being looked at almost on a mainstream side in the autism community. And the reason is because we started really recruiting some of these other practitioners. We really started getting them involved. We've really started saying, listen, come down with your patients, see what we're doing, help us get better, help us understand what's happening here. And then they understand it better, and they start identifying the kind of patients that are going to improve the most. So it's really, it's a team effort, because we cannot really take away their patients. We provide specific therapy, and then they need to go back and continue with what they've been doing before.
Yeah. So for any practitioners that are listening, this is, kind of a good idea. And I don't know, do you want to get into like, or the one practitioners say, hey, I think this would really help, or what kind of things you see, like who's ready for stem cell therapy based on talking to other practitioners?
Well, there's still some differences of opinion. There's a few practitioners that like to really kick things off with stem cell therapy, and they're like, listen, just go for it, because then we're going to get a lot better results once we start our interventions. There's some more conservative ones that want to really bring down any inflammatory markers, bring down the heavy metals, or try to control infections or inflammation as much as possible. In reality, what's important to understand is that stem cell therapy isn't really, we tend to compare it with with what would be a pharmacological equivalent, and there really isn't, because we're using our body's own repair mechanism. So it really doesn't matter if you have super high titers of whatever, of high viral loads or anything else, because we're using your own repair mechanism. So for us, we've seen good improvements with patients all over the place. We do work with different practitioners, and some of them do have different ideas. They do have different preferences, and we will always abide by them, because we understand that we cannot become these patients' practitioner. We will provide a therapy, and then they will continue care with their practitioner. So I don't want to be the one who gets in the way, and now they have a weird relationship because they cannot even tell him, oh, guess what? I did go down and get stem cell therapy. We want, like I said, we want to be able to work as a team. So I think the smartest thing to do as a patient is to talk honestly and openly with your practitioner about it. If he or she is honest enough to say, listen, I don't know about this, put them in touch with us. We do this regularly. We talk to practitioners all over the time. We all over the place. We talk to them at the different conferences. We're part of MAPS, Generation Rescue. So we go all over the place, and this is part of what we do. We not only have to educate the patients, we also have to educate practitioners. And we have them come down all the time. We just had a doctor from Italy come down a couple of months ago, and he came down with 2 of his patients, and he saw what we're doing, and he participated in the treatment, and it's great for everyone involved. We're getting more patients over from Europe, and they're seeing good improvements. So that's what we're really all aiming for.
Oh, excellent. So is there a good age? Like, I hear a lot of people in the autism community say, oh, you catch it younger and it's easier to treat. And what about, young adults who are 18 or in their 20s? What do you say about that?
So and I'm going to focus just on autism. The youngest patient with autism that we've treated, it wasn't an officially confirmed diagnosis, but he had an older brother, and he started exhibiting the same symptoms, and he was 2.5. The older brother was a confirmed autistic patient at age 5, and they're both kids of a physician. So she was convinced, and so were we. The oldest we've treated so far is a 29-year-old man with autism, low functioning, and they all see improvements. Now, it's important to understand the therapy itself is the same. So we harvest the cells, we expand, we culture, we put them in. Everything is the same, but what's different is what you do afterwards. A very, very important part of the therapy is, and that's really what sets us apart, because we're not trying to just, you come down here, get stem cells, and then go home. We try to really understand everything that's happening so that we can get you ready from the beginning, and then after the treatment, we can continue giving you steps to keep improving. And afterwards, what you need to do is you need to sort of push them out of their comfort zone. Something that's amazing that a lot of parents have reported is that after stem cell therapy, they were able to get their kids to do things which they wouldn't have done before. We've had kids who were totally terrified of water and ended up swimming in the ocean before they left. We've had kids who, they just had to sit in the same spot every time for dinner, and then suddenly they were switched and they were like, okay, cool, no problem. And really what's most important, or what's most difficult, is you have to be the one who promotes that change, because otherwise, think about, and you know this really well, and I'm sure that most of the parents listening to us will as well. Our neurons fire in a specific pattern. So we have a stimuli and we fire, and we have the same neurons going over and over. If we don't force them, even if we install a new neural pathway, if we don't force them to actually start taking the new road, they will always keep responding the same way. So what we really, exactly, it's habits. It's comfortable. They know it works. They know everything. This isn't magic. So we really need to push them. But what's different is that suddenly, instead of really throwing a fit, they start going in a different direction. They go like, oh, it's not that bad. I can actually do this. And, we tell parents, listen, a lot of the time it's very simple things that they need to change. We say, listen, just change the layout of the room. If his bed is facing this way, and maybe have it face the other way. Change, if they dress themselves, change the order of the clothes in the drawers. Change something like that. Things that they will notice, but that they can easily learn how to overcome. I say, if you're really brave, change the apps on the iPad. And they'll throw a fit, but after a couple of minutes they'll start seeing like, well, maybe this one isn't so bad, and they will start trying new things. Why? Because now they have that flexibility, and we really need to be careful with that neuroplasticity that we recovered first, and it will stay for as long as we stay without having new insults. That's why it's so important to keep doing the diet, keep doing the biomedical, keep doing everything else, because let's say you repair this and then you go back to doing the exact same thing that broke it in the first place, so you're going to have the same result. That's why any improvements that we get, as long as we don't have a new insult, they should stay. And not only that, now they're able to continue learning. And it does.
So, sorry, I was just going to ask that you say have them do something that's, not the habitual thing, but change the bed or change the location or change the dinner location or something. And then do you have them keep doing that? Like, once they're okay with changing where they sit at the dinner table, then do you tell them to do a next thing and a next thing?
Yeah, well, that's what's different between the younger kids. The younger kids, they are a lot more flexible. So at first they're like, oh, I can sit on the other seat. That's great. And then the next day they might want to sit on a different one. And the next day, but with the older kids, you have to remember that they might not be neurotypical, but they do have a personality. So it's a lot harder. All these different changes are a lot harder. They have a lot more years of bad experiences trying different things. So you will have a lot more pushback. We say that all the time to parents who say this. If it's a higher functioning kid, what we recommend is any kind of social activity. So team sports, anything that will get them involved and out of their comfort zones. And that's very, very important. And